Hi, my name is Sophia Williams, and I'm going to be presenting today from the Sophomore Biomedical Engineering Department from the University of Texas at Austin, and today I'm going to be talking about angiographies. So to start off, I'm going to give a little bit more background about what exactly angiographies are. So angiographies are a special type of diagnostic test that uses X-rays to look at blood vessels, and it can help diagnose several different cardiac diseases, including strokes, aneurysms, arteriovenous malformations, tumors, and clots. And here is just a typical angiogram scan of the heart and the brain. And there are several different ways that it is used, but the most common way is where a catheter is administered and a contrast allows the vessels to be seen. The contrast typically includes iodine because X-rays can't pass through them, so this is what allows the vessels to be picked up on the scan. And it can be used for vessel blockages, but also to diagnose abnormalities of the heart muscle or the valves. And there are three types of angiograms that are most commonly used, and the first one and the main one is a coronary angiogram. This one is the most common one, and it is also called cardiac catheterization, and it is typically performed in a catheterization lab or a cath lab. And it can diagnose arrhythmias, aneurysms, and other birth defects. And here I just have a really awesome video that shows the contrast being administered, so you can really clearly see if there were any problems in the vessels that weren't allowing materials to flow through them. So here's the contrast, and you can see the heart beating. Okay. And the next way that it's used is for an aneurysm. So an aneurysm is known as a bulging or ballooning in an artery. And here the scan can clearly show the ballooning of the artery. So you can really clearly see aneurysms on angiograms, and so that's why they are the most common test used to diagnose aneurysms. And the last one is for artery stenosis, which is also known as the narrowing of a large artery. So this image shows you before and after an angioplasty. And as you can tell in the left scan, there's not as much contrast material flowing through the vessel. And in the right scan, there's a lot more contrast material flowing through the vessel, meaning that the angioplasty was very successful. Now, there are several different ways that angiograms are used and interwoven with other imaging modalities, and several of them include X-rays, computed tomography or CT scans, and magnetic resonance imaging. So the most common one, as I said previously, are X-rays. And so X-ray angiograms are used by having a catheter administer a contrast that allows the vessels to be seen, and then an X-ray will provide an image of the blood vessels. So this image shows a typical X-ray angiogram. And the next common way is through CT angiography. And this is, again, where a contrast material is injected via the catheter, but this time a CT scanner will produce the images of the vessels and the tissues. So it gives a little bit more background in the scan and doesn't just give an image of the vessels. And here's a typical scan, and as you can see, it's a little bit less sharp than the X-ray angiography. And the last one is magnetic resonance angiography, or MRA. And for this one, it may or may not use contrast material, and a combination of magnetic fields, radio frequency waves, and a computer are used to produce an image. And some of the benefits of using magnetic resonance angiographies are that there are no radiation, and it's a lot less likely to cause allergic reactions because they may not have to use a contrast material. So here's a typical scan of the brain for an MRA, and as you can tell, it's not as high quality as the X-ray angiography, but you can still get a pretty good picture. So the way that the tests are typically used and decided upon is based on the patient and maybe if they have allergies, or also what the doctor needs to look at and how precise of an image they need. So there have been several recent advancements in the field of angiography, and the first one has to do with advanced guiding and planning. So 3D imaging using rotational angiography has allowed doctors to create a 3D image of the anatomy. And some systems have allowed the 3D images to be fused with live 2D fluoroscopic images, and this is used with software to better plan and navigate the vessels for surgeries or for device placement. The next one is radiation reduction. There have been lots of different ways that people have been trying to reduce radiation, and particularly in angiography as well. Some of the ways that they have been doing this is by using new X-ray tubes and more sensitive sensors and software to help improve the image quality at lower doses and reduce the noise. And lastly, there are also several newly released systems, such as the Discovery IGS, that are laser-guided systems, and they offer a more mobile approach. So they offer the mobility of like a CT arm scanner with the precision and high-quality imaging of a fixed stationary system. So for the future of angiography, we have some really exciting softwares that are being worked on, and the first one is FFRCT, and it is a software that can actually quantify blood flow in each coronary segment. It can also pinpoint lesions causing myocardial ischemia. So if the software is validated, it can reduce the need for catheter procedures and also just give a better idea of what areas of the heart aren't getting as much blood flow and could potentially cause a heart attack. The next software that's being tested is CT perfusion analysis software, and this maps the levels of contrast present in the tissue, and the low contrast in the myocardium indicates an area of ischemia or infarction. So as you can see, you get a pretty detailed 3D image of the heart, and the different colors illustrate the different levels of contrast. So you can get a lot better of a visual than just a regular angiogram. And in addition to these softwares, several different advances have been made to reduce radiation and reduce the need for catheters. So this is the area that angiograms are trying to go to. They're trying to make it a lot more safer and a lot more precise and a lot more quantifiable data than just an image. And here are my references that I used throughout the entire presentation. And I just wanted to say thank you for listening to my presentation, and I hope you have a great day.